24 hours, your baby will have several tests done. The first thing that we'll do is check your baby's weight. And I want you to know that every baby loses weight after delivery. That is normal. But what we monitor is how much weight loss. And so if it's more than 10%, then we'll start to make some additional plans. But just know that that is totally normal to have some weight loss right after delivery. The next thing that we'll check is your baby's jaundice level. We have a simple machine that just goes right on the forehead. It can measure the bilirubin level or the jaundice level right through the skin. Additionally, your baby will have a hearing test done. It's super fun to see. They have little electrodes that go over their ears, and then several electrodes on their body that measure brainwave activity in response to the sounds they're hearing in their little earphones. And it is super fun to watch that happen right in the room. There is one heel stick, so one blood test that happens at 24 hours. We call that the newborn screening, or sometimes it's referred to as the PKU. It tests for well over 26 rare diseases that are very important to know about. I always give the example to my patients about, for example, sickle cell is one of the things that it tests for. So those results will be sent to your pediatrician. And so that's why it's a good idea once you're here and you've had your baby to know who you're going to follow up with so we know who those results go to. And the last thing is a cardiac screening. So it's a simple, non-invasive test. We put a little sensor, little sticker on your baby's right hand and either foot, and it measures the oxygen saturation both in the hand and the foot. And we look to make sure that they're both above 95% and that there's not a big difference between the two. And so that's a simple, easy, non-invasive test. And that concludes all the things that we do at 24 hours.